Good evening and welcome to Talking Teeth Thursday, and I don't know whether this is live yet or not because everything's very slow this evening, probably because I've got a trillion windows open on the other computer, which is probably not very wise. Anyway, here I am. It's Thursday. This is what we do on a Thursday evening. We talk about teeth. So this evening I'm going to talk about women. I am going to talk about the female gender. I am going to talk about all things related to oral health and women's oral health in particular. Now, you may think she's completely lost the plot. She has not lost the plot. Tomorrow's International Women's Day, and do you know something? We don't often stop and think about how being a woman, just being female by gender, actually impacts our oral health. And not just the hormonal thing, which I am going to talk about a bit, but also about other things. You know, how many of our children rely on us to make appointments? How many of our grandchildren rely on us to make appointments? How many of our children who rely on us to take them to appointments? What about being role models for toothbrushing by, offering healthy snacks or water instead of a fizzy drink? Mothers and females have a lot of influence as far as oral health goes, and I like to think of women as influencers. You know, I am of that gender, and you know, Growing Smiles has a lot of us, projects well outnumbered. But you know, some dentistry is the same. Dentistry now has 60%. I think actually in and around that, but there's definitely more female dentists than there are male dentists in the UK. Now, you know, that was very different, a generation, even certainly 2 generations ago. But, we have more female dentists, dental team members. Look at the dental nurses. I remember coming across my first male dental nurse, and that was quite surprising. Now there's a lot more. Look at the therapists and hygienists that are male. Generally speaking, those male hygienists were those that had trained in the military. But we're in a very much different environment as far as dentistry goes. So I say you're much more likely now to see a female dentist than a male dentist. And I think the way dentistry moves and the way people want to work and get that work-life balance, I think that's something the pandemic sort of made us all stop and think about. A lot of people are working part-time, and that can work very well for women, particularly if they also have caring responsibilities, either for children or maybe another older family member. What we've got to remember is there's lots of times throughout life when, women's oral health is impacted, and purely down to the grounds that we are female. Pregnancy, puberty, menopause, those are just starting points. So I just want to talk a little bit about that. It's a big role, as I say, as an influencer, because, more women than men go to the dentist. More women than men actually brush their teeth twice a day. Their oral hygiene practices tend to be better, and they tend to have better dental health routines and dental care generally. Now, let's talk about those old hormones. So I don't have a lot in the way of slides. I don't even know why I put that up there this evening, so I do apologise. I've been trying to get something ready for a presentation tomorrow, and it's all been a bit mad around here. Anyway, let's talk about the old hormones, because if you're a woman, if you're a female, if you're a girl, if you're hitting puberty, you know about hormones. Hormones play havoc with our bodies, and what we don't necessarily realise, they also play havoc with our mouths. So, we know that puberty, you talk about moody teenagers, that's going through puberty, and women and girls will have much more likely to see inflammation in their mouth because their hormones are basically going poopsie. And it's all to do with estrogen levels. So, in particular, it's estrogen that throws things off a bit, and then what you get is an exaggerated response to the plaque biofilm that gathers around your gums and on your teeth. Now, the bottom line is, if you've got really good oral hygiene, you shouldn't see a big fluctuation. But the bottom line is that most people will see some of these milestones in their lives. So I'm just going to flip this over and shift this slide on. As I say, I'm not quite sure why I had that slide up at all, but I obviously there was method in my madness at that particular time earlier in the day. Anyway, so I say the biggest challenges are around hormones, and that can be not just puberty and pregnancy. If you use an oral contraceptive, if you're on the pill, childbirth. And then what the one people often forget about is menopause. And menopause is getting a lot of hype at the minute, a lot of press coverage because of alliances in the workplace and how women feel through menopause. But so often they forget about the impact it has on their mouth. And again, it's that hormone imbalance. And I often say to clients when I'm talking to them about, what stage are they in relation to menopause? Are they premenopausal? What stage are they perimenopausal? Are they in menopause? Are they postmenopausal? That could well be related to them seeing an increased inflammation in their mouth. So as I say, estrogen's the big challenge there, mainly because your mouth and your gum tissue have what they call estrogen receptors, and they really twig on then to when there's a change in that estrogen balance in your mouth. So it notices, so your gum tissue will notice if there's a raise, if your estrogen levels are rise, or if they fall. And that, again, same thing happens at pregnancy, but that then means that you're going to have an exaggerated response to the plaque biofilm, that bacterial plaque that gathers in your teeth. Now, if you're not sure what I'm talking about, so just in case, we're just going to rewind and do what I do so often, which is grab my tooth with my cotton wool around the gum margin. So this is cotton wool, this is the plaque biofilm. So as soon as you clean your teeth perfectly, what happens is this sticky film forms on your tooth. Now, if you take your fingernail and scrape your finger down your tooth, you should feel a sticky bit of sort of jelly-like substance. Now, that's the plaque biofilm. Now, what happens is you've got bacteria that live in your mouth. You've got about 700, 800 bacteria living in your mouth. Good ones and bad ones, but they colonate this plaque biofilm. Now, depending how long you leave that plaque biofilm undisturbed, it gets thicker and the bacteria can get really quite cosy in there. It's like a little community. They all talk to each other and invite their friends around. And what they can do is they can get up to mischief and trigger inflammation, because this sits right in at the gum, and you've got a little crevice just at the neck of your tooth where the gum and the tooth meet. And if you haven't gone and looked at the gum cleaning gum pockets video, it's still on the YouTube channel. But this is why it's so important to clean right in at the gum line there, because the bacteria get down in underneath there, and then what happens is they cause the gum tissue to swell up, and that's when it starts to bleed easily. And the first sign of gum problems is bleeding. Bleeding is your early warning sign of you having some sort of gum inflammation. So it's really important that you actually know what you're looking at. So if you're brushing and you spit out and you've got to see blood in the sink, or you see blood in your toothbrush, you're going to have to ask yourself why. It's really important, because what's happening is your body is responding differently. So if you've had no bleeding or no signs of inflammation, and all of a sudden your gums are bleeding, you're going, okay, what's changed? And one of the things that can change with women is their estrogen levels, is that their body is responding differently to the plaque biofilm, and they just become more susceptible. So that can happen. Some people, they talk about menstruation bleeding, and I mean gum bleeding. And what happens is while their periods are going, they get more bleeding, and then once their period's over, the bleeding settles down again. And it's just that change in estrogen levels that what happens is your body responds to an exaggerated response to the plaque biofilm that normally your body's quite happily coping with. So that sort of puberty is probably the first time that women might come across that. Then what happens is there are other times. So as I said, I've mentioned about the menstruation. Some people will find when they've got the period, they feel a bit run down, they feel a bit sluggish, they get mouth ulcers, they get mouth very dry. So there's a lot of things, maybe if you're susceptible to cold sores, again, those are the things that when your body is changing just for that period every month, that you actually become a little bit more susceptible to just not feeling on tip-top form. And the same thing goes with your mouth, that your mouth just isn't on tip-top form either. Bear with me a second, I'm dropping things all over the place. So as I say, that menstruation, gingivitis, when the estrogen increases, you get inflammation, and it's an exaggerated response. How do you resolve it? Well, you actually make sure your oral hygiene is A+. You really need to immaculate oral hygiene. The bottom line is always, if your mouth is healthy and you are doing a really good job, not only with your toothbrush and your interdental cleaning, you've got healthy gums, you are not going to have an exaggerated response because you are keeping a lid on that, if that makes sense. Another time that we often sort of overlook as women are oral contraceptives. And again, you know, inflamed gums are one of the most common side effects of oral contraceptives. And again, it's back to that gum tissue having estrogen receptors, so you've got that increased response to inflammation. And again, you think about it, you know, when you're taking oral contraceptives, you're taking a high dose of hormones, and so you're going to have that impact, you're going to have that exaggerated response, and you're going to see bleeding and inflammation if you are not meticulous about your oral hygiene. Pregnancy, interesting one, because depending on the studies have sort of shifted focus a little bit on this. It was, but generally we know there are problems. There's definitely association between gum inflammation and gum disease, and particularly severe gum disease, and poor pregnancy outcomes. So, you know, many women will experience pregnancy gingivitis, and that's again, you know, that gum bleeding that I was talking about there a minute ago, you know, when puberty, the same thing, estrogen levels change and your body responds differently. It's for a relatively short period of time. Usually once the baby is born, things resolve. The issue comes from if you have got severe gum disease. So if you have got severe periodontitis, you want to try and make sure that is treated and under control before you conceive, because it can have an impact on your outcome of your pregnancy. Either preterm or low birth weight babies are related to people who have severe periodontitis, severe gum disease. So, you know, getting yourself healthy and keeping yourself healthy before you consider starting a family is really, really important. When else these hormones come in? Well, funny enough, IVF. And again, if you know you're trying to, if you're going down the pathway of IVF, you again want to make sure that your mouth is in tip-top condition, because what they're going to do, they're going to imbalance, they're going to increase your hormones, and that in itself is going to have an impact on how your body responds to that plaque bacteria. So you want again to be really on top of your oral hygiene. That's stuff you can do at home. Yes, see your dentist, get yourself checked over, make sure that your mouth is in tip-top shape before you start IVF treatment, and make sure you are taking that time every single day to brush and clean in between your teeth thoroughly. Use a manual and electric toothbrush. Clean every surface of all teeth, the outside, the inside, the bit you bite on. Make sure you're doing that last thing at night and one other time in the day. Yeah, you can do it more often than that, but at least twice a day. You also want to make sure that you're using fluoride toothpaste. I'm going to come a little bit back to the old pregnancy thing, because there are other knock-on effects with your mouth when you're pregnant in some cases. But what you want to do is use the fluoride toothpaste, spit out the toothpaste, do not rinse out afterwards. Let that toothpaste stay around the teeth. Make sure it's working for you as long as possible. You've got to clean in between your teeth every single day. Find something you like. You know, there's lots of things to choose from. Don't have to be dental brushes. It might be little plastic pimply, rubber pimply things. It might be a water faucet, but there will be something for you. And if you're not sure for you, what's for you, give us a shout. We're here to help. But do that every day, once a day, before you brush, or at a completely different time of the day. It's more important that it's happening every day, because the bit that your toothbrush can't reach is that little spot in between where the two teeth are in contact, that little bit of gum in underneath there. So really important that you try and get under control any inflammation before you look at pregnancy, consider pregnancy, before you look at IVF. And you know, it's not the sort of thing that, you know, you don't go to the doctor, you don't go to the dentist and say, I'm preparing to be pregnant, you know, but it is something that we need to, as professionals, need to flag up more. And I think more as we work with our medical colleagues and our other healthcare professionals, we are going to get that message through that, you know, there really is no overall health without oral health being in that. So, you know, IVF treatment, you know, pregnancy, it's a finite period of time. So, you know, it has challenges at that point, but you always want to start healthy. Pregnancy. Some people get very nauseous, some people have horrendous vomiting, and that has a big impact on your teeth, or can, even over a relatively short period of time. Now, the big thing that you want to do is not go brushing your teeth immediately after you've vomited. Really, really important. What's happened is your stomach contents have come up. I don't need to tell you that. But they have a really, really low pH, so they're really, really acidic, and they basically can dissolve, particularly the back of your teeth. And what happens then is if you brush your teeth immediately after and the tooth surface is already porous and softened, you go scrubbing like this, you're going to actually wear away the tooth surface. So don't go brushing your teeth immediately after you've brushed. Now, the evidence in that is a wee bit this, but just as good practice, I would still err on the side of caution and not do it. So what do? Your mouth feels yuck. Get yourself a bottle of alcohol-free fluoride mouth rinse, even a mouthful of water, swish it round and spit out. Put a wee smear of toothpaste on. That will help to counteract that acidic challenge that you're getting from your stomach contents. Same thing applies if you've got reflux, so it's the same thing, you're getting that stuff up there. Likewise, something that's more common in women than is men, and it's not related to hormones, is eating disorders. And again, it's the same thing, that gastric juices are coming up, whether you're bulimic or you're not eating, has a huge impact on your health and your well-being. So again, often it certainly has been picked up by visiting the dentist. People that have eating disorder, particularly bulimia, sometimes they can have scarring on the roof of the mouth, but certainly they can have really nasty, really extreme acid erosion on the back of their teeth. So it's one of those things, again, slightly more common in men, but we are seeing more guys now suffering from eating disorders, and that goes back to that whole body dysmorphia, how we feel about ourselves. And I don't know, I'm not quite convinced that social media actually helps us in that mind. Still, rule of thumb, start healthy. So if you're not sure, get your toothbrush out, clean your teeth. If you're not sure if you're cleaning them properly, get yourself some disclosing tablets, get one of our disclosing toothpaste. Use that and you will see what you should be brushing. That way then, once you can see what you're meant to be doing, so plaque's pretty much invisible. If you can't see it, it's really hard to know how I actually cleaned it off. So using the disclosing tablet, or if you've got red food colouring in the house, also actually works. Just be careful because it can be messy, and make sure you put a bit of Vaseline or cream on your lips before you do it, otherwise you're going to have bright pink or bright blue lips. But the disclosing toothpaste are really good, but using that lets you see the plaque on your teeth. So you can see, there's just a picture there, you can see, hopefully you can see, I can't see what this is showing at the minute, and you can see the plaque that's gathering up around the gum margins and in between your teeth. And that's why we always go on about making sure that you're getting the toothbrush bristles in at that little crevice. Clean between first, brush thoroughly last thing at night, and one other time in the day. Now, what else happens to you? Right, we've talked about puberty, we've talked about pregnancy. Oh, the other thing we haven't mentioned is gestational diabetes. And again, are we getting better at diagnosing, or is it becoming more common? Like a lot of type 2 diabetes is these days, we're seeing more of it. Now, the scientific evidence and the experts tell me that you need to have a predisposition to diabetes to get gestational diabetes. And it's just that high levels of hormones again, and your steroid levels are high, and it has an effect, and you can get gestational diabetes. Now, this is where it gets even more interesting, because we know there's very, very strong links with gum disease and diabetes. Now, nobody's very sure about that gestational diabetes and that. It depends on where you are on that gum disease level, because you could have just bleeding gums, which is totally reversible, or you could have severe periodontitis where there's a lot of bony support has been broken down, and you actually, your mouth is in a bad way. It needs professional treatment and your daily work at home. If you have chronic or severe periodontitis and you get gestational diabetes, you're much more likely to have further problems. But again, it's a bit of it's a niche one. What you want to do is always start with a really healthy mouth. Make sure you're seeing your dentist regularly, because if you see your dentist regularly and you are planning to have a family, well then they're likely to know about that, and they can give you the advice and keep you on the right track in the middle of that, while you're doing it. I say adverse pregnancy outcomes include premature labour, and again associations rather than a clear causative effect. But again, what else we know is we know that oral microbacteria have been found in placenta. So there is some relationship then from the bacteria in your mouth actually transferring through your bloodstream to the placenta. So I say, the bacteria will travel, they'll colonise the placenta, and then you can get this overgrowth of bacteria. So I say this microbiome that we talk about, I'm always talking about it, that is really important to have a healthy microbiome so that you've got plenty of good bacteria that balance out the bad bacteria, and you actually control the biofilm that they colonate, that they live in. So that's the stuff that gathers around the gum margins, that's the plaque biofilm that the bacteria live in. So as I say, after pregnancy, usually these things will resolve, hopefully. They usually do. And once baby's born, hopefully your mouth will return to normal. The catch is with a new baby, the chances are you're exhausted. You have little sleep, you may not have any time to exercise, your diet may have completely out the window, all of which are things that we know can impact your oral health. So, really trying to prepare, again, before baby's born, to have your mouth in the best possible fitness, but as fit as you can get it. Also actually then allows you to have a little bit of leeway when you can't always brush your teeth. I remember I was talking to Mum not long ago, and she was brushing her teeth for the first time in the day at lunchtime, because that was the first moment that she had. The important thing that she was doing it, and she did it thoroughly. So you can sort of get away with a little bit of not ideal, optimal oral mouth care if you've started in a really good place. So if you start a really good place, you if it's dropped a little bit, you're not going to have too many detrimental effects. On the other hand, if you had chronic inflammation, you had signs of problems in your mouth, and then you ended up not brushing your teeth or not doing your oral care, the chances are that you could well get into some sort of trouble there. So as I say, lots to do with your hormones. Menopause is the other time that I haven't mentioned. Menopause, women often don't know where they are in the menopausal cycle, but it is something I always ask women, really from 35 onwards now. Where are you? Do you know when your mother went through menopause? Because we know there are lots of very unpleasant symptoms that can evolve through menopause with your mouth. So we know lots and lots of things change, but you can see redness in your gums, your gums are more inflamed, your mouth might be sore, you might have a burning sensation, you might have altered taste, you might have a really severe dry mouth. And again, it's back to that estrogen level dropping off. And some people will find their hormones are more effective than others, but it is, a huge change in your life, and it's a huge change in your mouth. So as I say, it's one of those things, starting off healthy is really important. Now, there has been some discussion about the relationship of osteoporosis and gum disease. They've suggested that there's this relationship between the two about bone loss in the jaw. Now, the researchers are suggesting that it can lead to tooth loss because bone density is impacted. It is not definitive by any means. Again, while there's more research required, the bottom line is that you need to look after your mouth really well. Another one. What about those people who are transgender? Again, nobody really has looked at it, but what happens because the hormones are being affected, they're being impacted by either being increased, so that again may well have an impact on gum inflammation. Bottom line is still practice good oral hygiene. What else do women do? Women are the ones that actually, have such a huge influence on the family's oral health, particularly if they do the shopping, if they do the cooking, if they choose the snacks, if they, start off them drinking water, and, if they feed them, breastfeed them. We know babies that are breastfed up to the first year are less likely to have decay than other children. So I say there's lots and lots of benefits of being a woman. What's not to love? We should all practice effective oral hygiene. I think that is really, really important. Take the time to brush your teeth last thing at night and one other time in the day. Clean in between every single day. Use a fluoride toothpaste, spit out, don't rinse. You're looking at one that is 1350 to 1500 parts per million. Look at how often and how much sugary food and drink goes into your mouth, and that includes the sugar in your tea or your coffee. Try and keep it to meal times only. Avoid it the hour before bedtime. Increase your fruit and vegetable intake. That increases your antioxidants. It makes you healthier and your body more resilient to fight off bacterial challenges and other infections. Don't smoke or use other tobacco products. Alcohol in moderation, 14 units a week for both men and women. Really important that. And keep acidic foods to meal times only. Again, if you've got a gastric reflux, if you vomit, don't go brushing your teeth immediately afterwards. Be mouth aware. If you don't follow us so that you will get that reminder every month to check your mouth for signs of mouth cancer. It is so important. If you are over 16, the HPV virus, oral sex, all come in to your risk of mouth cancer. So what you want to do is check your mouth for signs and symptoms of mouth cancer. You don't know, go to the website, go to the advice page, click on the mouth cancer, and you will see how to do a self-check. So important. Right, folks, until next week, that is all I've got to you. Women, what is not to love about women? All shapes and sizes, wonderful people, and let's celebrate International Women's Day tomorrow. But until next week, I will see you same time, same place, from your best brushing buddy. Don't forget to brush your teeth before go to bed tonight. I'll see you next time. Thanks for joining me. Bye.